Hi, this is Dr. Volstad of Volstad Chiropractic, and we're looking at one of our more recent patients who have used the Magnosphere. Say hi to Zephyr, a 9-year-old golden doodle who came to us because of some illnesses just diagnosed by his vet up in Tennessee, and his owner, Sharon. So Sharon, let me ask you, what did the vet tell you as far as what was wrong with Zephyr?
Zephyr was diagnosed 8.5 weeks ago with T-cell lymphoma, which is obviously cancerous.
Yes.
Major cancer.
Mm-hmm.
Fast cancer.
What kind of prognosis did the vet give you when he gave you that diagnosis?
He gave him 4 to 6 weeks max to live. And he actually even called the veterinary school up at University of Tennessee and discussed the results of the test with them, and they said 4 weeks.
What kind of symptoms did you notice at the time that kind of prompted you to know that something was wrong with Zephyr?
He quit eating, and he eats everything in sight usually.
Yeah, he looks like a horse, doesn't he?
He is a small pony.
He's a big boy.
But yeah, he basically quit eating. Then he kind of didn't look like he had as much energy. Just little tiny things the first time I took him to the vet.
Could you tell if he was in some kind of pain?
Not at that point. Not when I first took him, but a week later he had a splenectomy because his spleen was completely ridiculously enlarged. And from that point forward, it was going downhill.
Okay, what about energy? You know, I'm sure being a bigger dog like that, he probably isn't as active as a smaller dog, but he still would run and jump, etc.
Oh yeah,
what did you notice?
Before all this, in fact, 2 weeks before this, he was running around with other dogs in the neighborhood and, jumping and playing.
And then all of a sudden?
Then all of a sudden, it was just like, no, he could get up the stairs, a half a flight of stairs in the morning, but it was slow going. And sometimes he'd stand there and look at him before he went up them.
Now, you had mentioned something about him not jumping into the car, or that he was not able to jump into the back seat of the car.
When we came down here, like a month and a half ago, I guess it's been a month ago, that came down to Florida. He literally at that point, he always would get on the passenger side of the back door, and he would start to get in that way, and then he would put one paw up, and then he wouldn't go. And then so he finally figured out that he'd get on the other side by putting one paw at a time on the floorboards and getting into behind the seat and then up on the seat.
Instead of just jumping right.
And now, and instead of just jumping right in the car. Just right up on the seat, ground to the seat.
So let's see, I guess it's fair to say that Zephyr was really struggling. He was in pain. His energy level was certainly diminished. His appetite was all but gone.
Oh yeah, he didn't.
And I think you also mentioned that he wasn't sleeping through the night.
Oh no, he'd get up and pace. He would get up and you'd hear him. He would get up and move from one place to another and lay down again and then get up again a little while later and pace to somewhere else.
Okay. Well, now we've been treating Zephyr with the Magnosphere for, I think, 14 days. It's not been every day, but it's been most of those 14 days. And he's tolerated the treatment pretty well. So Sharon, why don't you give us an idea of what changes you've noticed in Zephyr since treatment started?
Well, since treatment started, he hasn't had one single pain pill, no kind of pain medication at all.
That's wonderful.
His appetite is more than back to normal. he eats, anything you give him. He was eating peppers last night that Meg was cutting up for a salad. So yeah, he pretty much eats his dog food all the way to anything else. I try to give him a lot more protein, obviously, but
and his energy level.
His energy level. I took him to the beach last weekend, and he ran down the beach for the first time he's run in a couple months, 2 or 3 months.
And now he's jumping into the car.
And now you take him outside. I say go, and he just jumps right from the ground into the back seat, no problem. And he can also jump up on the bed, which my bed's really high, so he jumps up on top of cedar chest and then onto the bed. So, but he couldn't do that either.
And I think it's interesting to note that we are about 8.5 weeks, maybe 9 weeks post that visit that you had initially with the vet in Tennessee. So his lifespan has certainly been extended.
Yes, it has.
And he's looking as good as ever.
Yeah, his skin, My daughter said that when we first got here, his coat was ratty looking, and now it's much softer and much smoother, and he's, you know, he sleeps through the night now. He does not get up anymore in pace.
Right.
He sleeps through the night, you know, and he, you know, he's, I wouldn't say he's back to normal, because, you know, it's, you know,
Right.
it's probably still there, but if it prolongs its life for any time, it's good.
Right.
You know, so
Well,
every day's a blessing.
It will be interesting if and when you're able to get back to Tennessee and get to the vet to hear what he has to say about Zephyr's condition.
Yes, it will. Yes, it will. I don't feel the lumps that I felt anymore either. So
Oh.
on the side of his neck, that's another thing too. I could
That's
feel
pretty
two
awesome.
prominent lumps on either side of his, you know, neck that now you have to really look for to maybe think that you might be feeling them. So
Looks like he's saying, okay,
Yeah.
Mom, that looks pretty good. Keep up that scratching. I like that.
yeah, he likes that.
Well, Sharon and Zephyr, thanks so much for the testimony here. And Zephyr, we will look forward to continuing treating with you here in the near future.
Say thank you.